I'm Sarah Goldvine, and this is Let's Talk Housing, a podcast by BC Housing. In this space, we explore the complex systemic issues that make it challenging for many people in British Columbia to access and afford a home. The provincial government has an ambitious plan with the largest investment in housing affordability in BC's history. Tasked with helping deliver on this plan is BC Housing, which is working with hundreds of partners to develop, manage, and administer a wide range of affordable housing and homelessness services in hundreds of communities across the province. In this podcast, you'll hear from those delivering innovative and exciting affordable housing solutions. This week on Let's Talk Housing, we're revisiting an episode from Season 1 about housing for women and children leaving gender-based violence. I want to note that we will be discussing violence against women in this episode. Please take care of yourself if this content is difficult for you. Before we begin, I'd like to acknowledge that this episode was recorded on the ancestral and unceded homelands of the Musqueam, Squamish, and Tsleil-Waututh, and from the territory of the Syilx Okanagan Nation, who've been the caretakers of these lands for thousands of years. We offer respect to their peoples, past and present. Also, in full transparency, this episode was originally recorded in October of 2021 and reflects the issues of that time. I speak with BC Housing's Sairoz Sekhon and Allison McLauchlan of the Kelowna Women's Shelter. Sairoz is the director of the Women's Transition Housing and Supports Program. BC Housing supports more than 110 transition houses, safe homes, and second-stage housing for women with or without children who are at risk of or who have experienced violence. Allison is executive director of the Kelowna Women's Shelter. For more than 40 years, the Kelowna Women's Shelter has been providing temporary safety for women and children leaving violence. Over time, the organization has evolved to offer several programs that break the cycle of abuse by helping women rebuild their lives, develop resilience, navigate systems, and heal from the trauma caused by domestic abuse. We began the conversation by looking at the problem of gender-based violence. Hi, everyone. For this episode, we are discussing violence against women and how the province and nonprofit housing organizations are supporting vulnerable women. Before we get underway, I do just want to let listeners know that we are going to be discussing violence and gender-based violence. And so please take care of yourself if this content is difficult for you. Before we begin, I want to acknowledge that we are recording this entire podcast on the ancestral homelands of hundreds of Indigenous peoples and nations across British Columbia, each with their own unique traditions and history. Today, where I am is on the ancestral and unceded homelands of the Musqueam, Squamish, and Tsleil-Waututh nations, who have been the caretakers of these lands for thousands of years. We offer our respect to their peoples, past and present. Also, for full transparency, this episode was recorded in October 2021 and reflects the issues faced at that time. BC Housing's Sairoz Sekhon is joining us today. Sairoz is the director of the Women's Transition Housing and Supports Program. BC Housing supports more than 100 transition homes, safe houses, and second-stage housing for women with or without children who are at risk or have experienced domestic violence. We're also joined by Allison McLauchlan, Executive Director of the Kelowna Women's Shelter. For more than 40 years, the Kelowna Women's Shelter has been providing temporary safety for women and children leaving abuse. Over time, the organization has evolved to offer programs that break the cycle of abuse by helping women rebuild their lives, develop resilience, navigate systems, and heal from the trauma caused by domestic violence. Thank you all for joining us. Let's start just by setting the scene a bit here, because many of our listeners might not be that familiar with the topics we're discussing today. Sairoz, you've worked in the anti-violence sector for more than 20 years. And from your perspective, are we seeing an increase in the amount of domestic violence towards women and children, or is it just that there's more awareness of this model?
Yeah, and I actually think it's a bit of both in terms of what we're seeing. I think there's increased research that's being conducted. I think there's more data that's being collected that's giving us more information, more actual numbers, and more information around the trends in terms of what we're seeing. But I also think that there is increased awareness that's happening with respect to lots of individuals, friends, families, communities they're actually starting to talk about this issue much more openly. I think it's an issue that there's been a lot of stigma around and has been taboo in many ways. And I think a lot of that is starting to break down. And I think we're seeing this in various different ways, at a local level, at provincial, national, and global levels as well, just all those different scales. I think about different awareness raising campaigns that are happening. And one in particular is May 5th, which happens to be Red Dress Day, and also the National Day of Awareness around missing and murdered Indigenous women and girls. And it's a day, across the country where red dresses are hung up in communities to really raise awareness about the missing and murdered Indigenous women and girls. And that sparks so much conversation amongst individuals, whether they're driving by and seeing the red dresses or having those conversations within their communities. And I also think about what we're seeing just within the mainstream media. I think about a recent Netflix series, The Maid, that several folks have told me about. And it follows the story of a young woman who's leaving a domestic violence situation. It talks about intergenerational trauma as well, and all of those different dynamics and challenges folks are faced with. And also a lot of the media coverage I think we've seen in the States around Gabby Petito that's gone missing and is suspected of being killed by her abusive partner. What I think 20 years ago would have maybe not even been a story in the paper is now headlining newspapers, and not just for a day, but for weeks. So I definitely think it's a bit of both, and we're definitely seeing an increase.
Thank you for that. And Allison, I'd like to bring you in here because, of course, the Kelowna Women's Shelter first opened in 1980, so more than 40 years ago. And at that time, domestic abuse was often kept behind closed doors. Do you think that things have changed, or how do you think things have changed since that time, and how have your services evolved?
Yeah, I would say that things have certainly changed to how society or social systems view domestic abuse and violence. However, like Sairoz alluded to, there's still so many myths and misconceptions surrounding the issue that it does tend to continue to live in the private. And we've come a long way, but we still have a long way to go. Anytime I'm talking to anybody about this issue, I still hear the same kind of myths coming up as, it's because of drugs and alcohol, or why doesn't she just leave? So those old stories that have been around for so many years as to what domestic abuse is and the impact that it has on women and children, they're still very much alive. We're certainly having more conversations about it than we ever have before, which is amazing that there's still advocates out there who are willing to bring this out of the shadows, because it lives in the shadows. That's the only place that it can live. When we talk about it and we call it out and we bring the realities, the truth about what it does to women and children, when we start having those conversations, and the women's sector has been very vocal since the 1970s, and we're still screaming out loud. And thankfully, we're some people are listening to us. People want to understand this issue. They want to understand, and that is awesome. We just need to keep talking about it, because women and children are still dying every day at the hands of their abusers, and it needs to stop.
Thank you for that, Allison. And Sairoz, as both of you have touched on, we have some increased awareness. People are talking about this violence now, and they're talking about the women and children who are losing their lives. But what we've seen even during the past 19 months is that this issue has become even more complex during the pandemic. So we're seeing increased partner violence, and not only an increase in the violence, but often an increase in the severity of that violence. So Sairoz, can you talk just a little bit about how BC Housing and its partners have responded to help women and children who are fleeing these situations over the past 19 months, in particular during the pandemic?
Yeah, absolutely. I mean, the pandemic has been difficult for everybody, but especially difficult for women and children that are not safe in their homes. And the provincial government and BC Housing have been able to respond and support our providers operating these programs, but also to ensure that women and children still have safe spaces to go by initially setting up an additional 300 spaces across the province. And that's primarily through hotel rooms to ensure that there were still safe places for women and children to go. And at the start of the pandemic as well, like we knew that there was a requirement for physical distancing. That was one of the ways to keep everyone healthy and to really prevent the transmission of COVID. And transition houses are often communal living settings. So there's lots of shared spaces. They're sharing bedrooms, they're sharing washrooms, they're sharing all of the living space. So we knew that we needed to create some distance. And so we were able to set up those additional spaces for women and children to go if they're symptomatic, if they may be COVID positive, or if there's just not enough space within the transition house at the time. And some other ways that we've been able to support our partners during this very difficult time is to be able to support them around the ways that they've needed to adapt. So, that increased need for cleaning, needing to wear masks, had to have sanitizer on site, to have that personal protective equipment and access to those supplies. So we've been able to support our providers to access the supplies that they need by being able to provide them directly to them or to support them in the purchase of those supplies as well.
Yeah, I mean, those are all really good points. It's not only an increase in the pressures that people are facing, but also the need to deliver services and, ultimately operate housing during the pandemic. Allison, can you talk to us a little bit about what that's looked like for the Kelowna Women's Shelter? How have you been able to keep your doors open during this global crisis?
I think tenacity and a commitment to the issue. Since day one of the pandemic, I think as a team, our goal was to always be present, let women and children know that we're still here. We're ready whenever you are, because obviously at the start of the pandemic, what we saw was a decline in calls and women reaching out for support. That's purely because of the stay-at-home orders, and women weren't able to get out of the house and make those calls to us safely. So we knew that we would go quiet, and we did. We just needed to keep the focus on the fact that we're still here. We still know that women and children are surviving this daily. And when the time's right for you, give us a call. We're still open. I guess a commitment to being there for women and children, and an understanding that the pandemic did not cause an increase in domestic abuse. It just caused an increase in the severity and the number of incidences. And I'm glad that you mentioned that, because that's one thing that I always really want to make clear is that women and children were surviving this before the pandemic started, and they'll continue to survive it after it goes. So it didn't cause it. It just caused an increase in the severity and the number of incidences. And we wanted to make sure that women and children knew our doors were open and the team were here whenever they were. And I don't even think we thought for a minute we should close. That was never in our minds. We weren't going anywhere. And thankfully, like Sairoz said, BC Housing were on hand to give us those extra spaces that we knew we would need to keep everybody safe. But we're not going anywhere.
So Sairoz, as Allison touched on, gender-based violence predates the pandemic, and it isn't going to go away with the arrival of vaccines. In your opinion, are we keeping up with demand? Do we have enough of the housing we need across the province to help women escaping violence?
Unfortunately, no. We haven't been able to keep up with the demand. We don't have enough safe homes, transition houses, second stage housing, and long-term housing in particular to meet this demand. So even prior to COVID, as Allison was saying, this issue was very much alive, and one that we were continuing to address and struggling to address at times. However, thankfully, in 2018, the provincial government did announce the Building BC Women's Transition Housing Fund. And that funding includes $734 million over the next 10 years to create 1,500 new spaces province-wide. And so that is really going to address those gaps that we're seeing right now throughout the province. And we know some of those gaps are very much related around second stage and long-term housing. So women are getting stuck sort of within the transition house. It's not necessarily a 30-day stay anymore because they don't have anywhere to move on to after. And are still needing that support and many times still needing that safe housing. And so there's that gap with the second stage and long-term housing, but we are meeting, we are trying to address and meet that issue for sure. So we have a number of new projects that are underway throughout the province. 26 projects have been announced, and we have many more that we are actively working on. And we have some that are operational and more that will be soon as well. So that's definitely going to make a big difference in terms of addressing this need and making sure women and children have safe places to go.
Yeah, so certainly a lot that's been done, but still so much more to go. Allison, I'd like to get you to respond to something that Sairoz raised there, and just really the importance of creating homes for women to move to after they've been in a transition home or a shelter. Can you talk a little bit about, for the women and the children that your organization serves, what is the importance really of building housing across the entire housing spectrum of all types?
It's key. It's key to move women from crisis to stability. I mean, housing is one of those safe, affordable housing that, some of us have the privilege of taking for granted. Women and children leaving domestic abuse don't have that privilege. Housing. The slogan we used last year for our anniversary was Kelowna Women's Shelter, we're more than a house, because it's not just a roof. It's so complex. More and more women are coming to us who have experienced years of financial abuse, where they have no access to finances. They have no education. They have no career training. They could quite often have 3 little kids under the age of 6. So we can provide housing, but how do we support women with childcare, with financial stability? How do you get a job if you have 3 children and you can't afford childcare? It really is. It's domestic abuse is an issue that just infiltrates so many other social systems, and sometimes that can get lost. Like the quote I said at the beginning, well, why doesn't she just leave? There's so many reasons why women can't leave or choose to stay in that moment, and it's so complex. So we can. I keep saying, I love that we're building second stage. It's a huge piece of the puzzle from the domestic violence sector. However, we need the other systems to come on board with us as well. The legal system, the financial, we need it all, because this is just not fixed by putting a woman and a child in a home. There's so much work that needs to get done, so much trauma and healing. And it's not going to be fixed by putting a roof over her head. It's great. And I love that we can do it. And I love that BC Housing and the government have committed to bringing an end to violence against women and children. There's just so much more work to do.
Yeah. I think Allison has touched on some really, really important themes there. And Sairoz, I'd like to invite you to respond to one thing in particular. And really we take a look at all of these systems, right? We're here talking housing today, but ultimately housing exists within a system that is very, very complex, and often, certain women are even more marginalized within that system. So you mentioned, Sairoz, at the beginning, missing and murdered Indigenous women and girls. Can you talk a little bit from your perspective about the importance of a culturally informed approach to providing housing and support services for women that are fleeing violence?
Yeah, and that is just so important and one of the pieces that we really are focusing as well with respect to the new funding that we have available to develop new programs is that we know that in so many communities that often we will only have that one program, and it may not be able to serve the needs of all women. And we have heard from numerous Indigenous groups and communities about their needs not being met, and really needing a program that is culturally safe, that is culturally appropriate, and is also, has those Indigenous roots, and can provide those type of services. So that's definitely been a significant piece that we've been working on. And also just with respect to our data and our existing programs, we know that Indigenous women are hugely overrepresented with respect to accessing these programs and with respect to experiencing violence. So we definitely need to ensure that we're meeting their needs, that we're able to develop and offer safe housing and programs that will work for them and are accessible.
Yeah, and I mean, you've touched there, Sairoz, on the importance of programs being accessible, right? I mean, these programs are really helpful if people can access them. Allison, can you talk just a little bit about this? I mean, we know that many women have intersecting experiences of abuse, trauma, mental health, and all of those can present barriers to actually accessing programs and services. And that, of course, makes these women even more at risk of homelessness and then further violence. What do you think that we can do as a society to help really improve that situation?
Well, I have to say that over the past 5 or 6 years, there has been a huge push from the women's sector to move to more low barrier practices. As you said, there's a lot of research about the intersection between domestic abuse, addictions, and mental wellness, and we know this as a sector. We've known this. However, we didn't really practice what we were preaching within the shelters. We were explaining to women, you have to be clean and sober before you come in here. You maybe have to access addiction services. You have to have a mental health worker. And yet we were saying loud and clear, we understand why these unhealthy coping mechanisms were put in place to keep you safe so you could get up and get on with another day. So we were saying, we understand that, but you can't come to us if you don't do A, B, and C. So we really were part of the problem when it came to bring in the most vulnerable populations into the women's shelter. They were very rule-based, very black and white. If you break rule A, then you'll have to leave. And, I hate to say it, but every shelter I have worked in has had a binder of women that do not admit list, where women, if you broke a rule or you broke it once, twice, you would be put on the naughty list and not allowed in. And that really makes me sad as a sector that has told women that we are here for you, we understand, we get it. But we weren't working towards those values and those principles. So thankfully, there has been a shift to move to the low barrier framework, where we work with women on a needs basis. We meet her where she's at, and addictions and mental health. We will work with you on those issues. So it's really key to have our community partners with us, because I'm not an addictions expert, nor am I a mental health expert. But I do have a level of understanding how all of three of them play together and what can cause, what the impact is. But we really need to work closely with our community partners and not be part of the problem. We need to be part of the solution. This is where women and children, this is where they first come. And if we close the door on them, we've lost her. We've lost her. Our attitude, the way we respond that first time she calls, could mean the difference between life and death. And that's, for me, we got to get it right, and we got to get it right first time, because we will lose women and children. They already fall through the gaps. We cannot have the violence against women sector being a part of that.
Thank you for all of that, Allison. You've really touched on some really important themes. And, as you know, this really is a matter of life and death for too many women and children. So, Sairoz, I wanted to come to you for the last question. What gives you hope?
What gives me hope is having gone through the pandemic, and we're still going through it as we are here in the fourth wave, knowing that we are working with service providers that have demonstrated such resilience, such strength through this all. Just even hearing Allison, talk about never for a minute thinking about closing doors and turning our backs on the women and children that need these services, and just watching everybody adapt and hang on and keep going through this difficult time. I just know that just seeing all of that and knowing, we're working with a really strong sector to begin with, a really strong group of women that are passionate and dedicated to this work. And COVID and this pandemic has just ignited that even further. So that really gives me hope. And it gives me hope as well, just knowing the work that we're able to do here at BC Housing, the commitment that we've made with the Building BC Women's Transition Housing Fund to create and develop new spaces. We're at over 1,000 spaces right now. 1,500 more spaces will be coming across the province. And so, more than doubling what's available at this time. So that really gives me hope as well that we are going to be able to address some of these gaps and make a difference. And by working with strong service providers province-wide, we're going to be able to do this. So I feel hopeful about that.
What a great note to wrap this conversation on. I really want to thank Sairoz Sekhon and Allison McLauchlan for joining us on Let's Talk Housing. This has been a very moving conversation today, and we really appreciate your time.
Let's talk again soon. Women in British Columbia who would like more information about programs and services for people fleeing violence can call or text Victim Link at 1-800-563-0808. That's 1-800-563-0808. In other areas of Canada, visit sheltersafe.ca for a list of resources in your community. If you are in danger, please call 911. To learn how to apply for subsidized housing in British Columbia, visit our website, bchousing.org. You can also call us at 1-800-257-7756. That's 1-800-257-7756.